What if there was a way to reduce pelvic pain, boost intimacy, support hormone balance, and even regenerate tissue using light painlessly and effortlessly? It sounds futuristic, right? Well, it's not. It's here. In today's episode, we're diving into a breakthrough in women's wellness. This is pelvic light therapy. We're talking about how red and near infrared light can activate healing deep in the pelvic region, supporting everything from perimenopause symptoms to postpartum recovery, sexual wellness, and cellular regeneration. Joining me are two incredible women from Fringe Heals, a company at the cutting edge of body, mind, and spirit healing. Dr. Genevieve Newton is Fringe scientific director. She brings science behind this innovation. And Liz Frey, with a background in both tech and trauma healing, brings the vision and the why behind this revolutionary device. We're covering what the pelvic wand is, how it works, who's it for, and the real transformations women are experiencing. Trust me, you'll want to listen to the end. Well, welcome, Liz and Jen, to the Girlfriend Doctor Show. It is so good to have you here.
Thank you, Anna. It's
Thanks
great
for
to be
having
here.
us.
I am thrilled to talk about this topic. It's something that's very popular in my Girlfriend Doctor Club and in my sexual CPR program. We've got in-depth discussion of this, and I want to go even deeper with you guys today. We're talking about light therapy for the pelvic region. And when we're saying this, there's all different kinds of light therapy, Mona Lisa therapy, different types of energy therapies that are being advertised for vulvar-vaginal rejuvenation. And so I'd like to dig into this with you. What is light therapy?
Yeah, I'll take that question. And it's a good one to kind of differentiate, because a lot of people, when they think about light therapy, they immediately go to red light therapy. And of course, at Fringe, we sell several products that are only red light therapy. But our pelvic wand and our face mask are not just red light; they're also blue light therapy. So we need to just generalize that now to talking about light therapy, which in super simple terms is just using light to influence biology. So for the purposes of pelvic health, typically what we see are red and near infrared light, which both come from the sun, and then also blue light, which is also part of our visual sun spectrum. So really it's using that energy from the sun that we essentially have been exposed to since the very beginning of life on earth, and using that to positively influence our biology and bring about things like decreasing inflammation and reducing pain. And remarkably, there are so many cellular effects that take place. I think for most people, when they dive into this area of research and kind of learning, it's really, really shocking to see just how many things are influenced by light. But it's not that surprising when you think about that relationship between light and biology. We have always been exposed to light.
Well,
Light is life.
absolutely. Light is life. And I think that's how we act, and our body actually makes light. And so understanding that,
Yes.
especially at the cellular level, it's powerful. And certainly we use light in my medical practice to help with rebalancing, stimulating the immune system, stimulating the mitochondria, and decreasing inflammation. But when it comes to pelvic wand use, what specific
Yeah.
wavelengths are needed? So there's a range, and why did you choose this certain wavelength?
Yeah, and so to answer this question, we need to, think about the differences between light sources. So when we're talking about light therapy, it can either be from a laser or an LED light. So if we're looking at laser therapy, which a lot of women have used in clinics, in office with a healthcare provider for vaginal rejuvenation, if you're using a laser, you can only use a single wavelength of light. So that's type of therapy, you need to be very precise about selecting the appropriate wavelengths. Now when we're talking about using LED lights, if you look at the way that LED lights generates light, it actually spans a spectrum of light. So this is one of the things that people don't realize when they go and they look at different products. For example, our red light therapy or light therapy wand, the red and the near infrared light, we can look at what wavelength specifically is our peak light, but it's actually a range. So if people are interested, we provide all of the spectral analyses of our products on our website. And what you see is our red actually ranges from about 500 and 790, 590 to 660 nanometers. So it's about, 70 nanometers in range, but then there's a peak at 630. So we would say that it's a peak of red light at 630, and then we also have a peak of near infrared at 830, but it spans a range of a similar spectrum of about 70 nanometers. So we selected those wavelengths based on the clinical research that we know about, the optimal stimulation of mitochondria and cells. But at the same time, we know that we don't need to be like we are with lasers, where we're picking just one specific wavelength, because the cells are getting exposed to a range of wavelengths. And then for the blue light, we have 415 nanometers. And that's also based on some of the research that's shown kind of these really positive results. But I don't want people to get too hung up when they're talking about red light or blue light or near infrared light from LEDs with looking for one specific wavelength, because there's going to be many
Well,
that
and
are in
when we
there.
think of the research, I would love for you to share some of the clinical research supporting red light therapy for intravaginal use, blue light therapy, and near
Yeah.
infrared. When do we use which?
Yeah, absolutely. Yes. So I've done a very, very deep dive looking at this, and it's really fun because there are an increasing number of studies that have been being published, and they fall into several different categories. And so the categories relate to the different clinical outcomes that are related to the light therapy. So for example, if we're talking about menopause related symptoms, menopause we know involves changes in the vaginal structure, vaginal dryness, vaginal atrophy. So there was a really interesting study that looked at vaginal atrophy, specifically at some of the tissue under a microscope, and found that there was an increase in or a decrease in atrophy, an increase in the size of the tissue with exposure to red and near infrared light. We also have this category related to pain. So we know that exposure to light, red, and near infrared has the effect of decreasing inflammation, which can decrease pain. It increases blood flow, which can decrease pain. So there have been two studies. One looked at chronic pelvic pain, another looked at bladder pain and interstitial cystitis. Both found significant results in terms of decreasing pain. And then we've got this category related to microbes. So in the vaginal microbiome, we can see improvements in sort of microbiome species. And then two studies have looked at candida infections, which of course we know are a huge issue for so many women. And then another one looked at HPV infections. And that's also a big issue for a lot of people. And unfortunately, this study didn't use light therapy exclusively. It combined it with interferon treatment, but it did find that that combination of the light with the interferon was more effective than just using interferon alone. So those are a few of the different categories. And then another one that a lot of people, maybe are less familiar with in that pelvic region, but it's also a need at some points in our lives, is wound healing. So post episiotomy, for example, there was a study that looked at speeding up healing using exposure to light. Under those circumstances, you may be are not necessarily putting the light as far in intravaginally. You're going to be using it more in the external, outside of the body, maybe not even making tissue contact, but there's also the potential for benefits there. And then incontinence. So incontinence has been looked at usually in combination with vibration therapy. And these two things work really well synergistically. So combining the light therapy with vibration, we see improvements in incontinence, a reduction in urine leakage. And then the final category is sexual dysfunction, which of course is very, very important. And again, most of those studies have combined the light therapy with the vibration. And that's why we combined them in our pelvic health wand. It just makes they work so well together, and they have some overlapping mechanisms, but a lot more of their effects, they have overlapping effects but different mechanisms. So for example, with pain, we have vibration therapy helps to gate pain sensations, whereas red light therapy helps to reduce pain more by reducing inflammation. So you can kind of come at these things from different angles and just hit them even harder,
I
which
think
is
the
really
key
lovely.
areas, these four key areas that affect women's health in general, right? Then infections,
Mhm.
pain, discomfort,
Mhm.
the atrophy areas, incontinence, and of course, sexual function. So, like all of this comes together. What was interesting in the research, like ACOG published several years back, said, well, okay, we look at this, intravaginal laser therapy and say it's not good for the postmenopausal woman. And they're not seeing
Mm.
significant benefits in the postmenopausal woman, but that's because of atrophy and decreased water, right? Decreased cellular health, decreased water, decreased glandular secretions. So the combination with restoring that and integrating these additional therapies, like for example, with hormone therapy, with DHEA, with vibration, light therapies, we can really in the postmenopausal women, because I know because my clients are in their 60s, 70s, and 80s using this combination of therapy with really good results. And so
Yeah.
when the ACOG and when American College of OBGYN, when we send something like that out, then physicians are just telling their clients, oh, well, probably no good benefit to you. And women are left to suffer and struggle. And I think what's really important is this
Yeah.
microbial aspect. When we think, okay, as the vagina ages and there's decreased glandular secretion, there's an increase in diverse microbial species, which leads to infection, odor problems, as we age. And the keeping vaginal health is necessary for optimal health. And there is no age limit. And
Yeah.
it's so important that we address this and we come out with the safest modalities that we can. So when it comes to this topic of women's health, like using the wand, there's you've seen benefit postmenopause as well.
Oh, yeah.
Absolutely. Yeah, absolutely.
Yeah,
Liz,
I
do you want
can
to speak to
speak
that
to
a bit?
that for sure. In my pelvic health practice, I see women throughout life, both postpartum and postmenopausal, and the results postmenopause are phenomenal. And that's often because women need something extra, something more to help them kind of overcome, say, tissue weakness or their dryness, the atrophy. And the pelvic wand seems to be this just additional home use product that can help them get that extra, like I'll say, extra oomph to get on their way, if you will. Yeah, very beneficial.
And so, as a pelvic floor physical therapist, and I think this is such my favorite people, right? So essential for pelvic health. Everyone should see a pelvic health, pelvic floor physical therapist because if things aren't going on well down
Mhm.
there, it really affects our quality of life. And so, what are some of the common things that you're seeing as a pelvic floor physical therapist, especially in the menopausal and postmenopausal patient?
I'd say the genitourinary syndrome of menopause. So women that are coming in, they'll often be coming into my practice with a complaint of leakage. So incontinence, right? That's what will bring them into the clinic. But then when we take a deeper dive to say, hey, why are we having this leakage? What's happening in the pelvic region? They might be even surprised to find out that there is atrophy and weakness, and that's why they have some of the leakage, right? Often it'll also be associated with maybe a low grade prolapse that they may or may not um, be aware of or sensitive to. So I would say in the postmenopausal population, it is leakage that brings them in. And then when we dive deeper, we'll discover this is maybe why we're having the leakage. So what I'll do is I'll work with women looking at like developing strength using their muscles in clinic and then ask them if they're willing to use a pelvic wand at home because the vibration settings, there's 4 different vibration settings on the wand, and the I'll say top 2, like if there's 4 levels, level 3 and 4, if you will, are a higher level vibration that can help stimulate the muscles. So the brain and the muscles of the pelvic region can kind of reconnect because often for a number of years, maybe even since they were postpartum, these muscles haven't been overly functional, right? The woman might just not have been aware of that until menopause. So having the vibration setting number 3 or 4, in addition to, as you had already mentioned, the benefits of red light can be such a lovely combination. So the red light will help increase blood flow to the tissues, which brings oxygen and nutrients for sort of tissue integrity and health. Red light therapy helps increase elastin and collagen production. Again, these are like structural elements to help support the growth of the muscles in the pelvic region. And then Genevieve had already sort of mentioned this cascade of reactions that happens at a mitochondrial level increases just the overall energy and therefore cellular health in the vaginal region. So if we combine red and near infrared light benefits with vibration therapy and home exercise for the postmenopausal woman, it is like, I'll say magic. It really is. It's a great combination. And I'd say that's where I'm seeing the most success in my practice. And then secondary to that, not as much in my practice, but people that have, I'll say, written testimonials or giving us feedback on the wand, I would say a huge number of women who suffer from pelvic pain are the ones that tend to write in with, honestly, like stories that would make me cry. They're like their pelvic pain, whether it not it be from IC or endometriosis or post-surgical, like a hysterectomy or something to that effect, that are using the pelvic wand in a completely different way in terms of the vibration, maybe using the vibration at level 1 and 2 to help reduce tension, right, in the pelvic floor muscles and reduce overall pain and inflammation. So that would be the other category, if you will, that I'm seeing just huge benefits, and people really really appreciating the at-home ability to manage their symptoms.
Yeah, and I want to talk about the pelvic one. We're keep talking about it. I'm going to show it here for those who are watching YouTube. You can see it, but I'll describe it. So it looks, I mean, it really looks like a dildo. It's a long conical structure. It has a nice soft silicone base, and it has, you know, these, the light therapy. So you can do blue, red, and the near infrared or the combination. Right? Can you do combination? Okay.
Yeah.
And vibration. And
Yeah.
so vibration stimulating blood flow combined with red light therapy is excellent. So I want to talk about how you're using this. And I like this wand. And this is one that I recommend to my patients because it's thinner and you've added in the blue light and the different, you know, the red and the infrared. So it has a spectrum where we can use this for a wide variety of issues as part of healing and maintaining the pelvic floor. So let's talk about that.
Of course.
And again, you can use it externally, like you said, for post-episiotomy, or if it's too tender, you know, it's still, or too atrophic, it can be used just to lay on the pelvic floor. I would say clitoris to anus, the most important real estate of our body.
It totally can, and or over C-section scarring. The curvature of the wand, you were holding it up there, is actually often the curve that you would see, or the outline of a C-section scar. So that can also be a really nice use of it. I just wanted to add that in. So the recommended use for the wand is to use it 3 to 5 times a week. 10 minutes at a time, and there is a built-in 10-minute timer, so it kind of takes any of the guesswork out of it. And you can use it with, or as you already said, with or without vibration, depending on what you and your pelvic health therapist have maybe discussed or what your symptoms need at that time. And some people will even, within a 10-minute session, use, say, a low-level vibration initially if there is a little bit of hypertension or pelvic tone. And then as the tone settles, maybe they progress into using a higher level vibration and working maybe on strengthening exercises with the wand. So it doesn't have to have I'm only using it in this, like for this one, with this one setting, right? Other people will use blue and red light combination. That can be of benefit. So 3 to 5 times a week for 10 minutes. So essentially once a day is the recommended dose, and not more than that. So it's kind of nice in that you don't feel like more is better, right? No, once a day is ample. And then the other time that I recommend using the wand is prior to intimacy. So my postmenopausal women, this can be a lovely way to increase essentially lubrication in that we're increasing blood flow to the tissues. And with increased blood flow, you'll have increased secretions, right? So that is the time of day, if you will, if you're going to be intimate, that I would recommend using it, and 3 to 5 times a week.
Great. And then as far as like can you use it too much, right? Like if someone's like, okay, I've got
Yeah.
incontinence issues, I really want to use this twice a day and get
Yeah.
quicker results faster, or
Very important question, because I think as
more
humans,
is better.
we just, and I'm so guilty of this. More is better. If a little bit is good, then more has to be excellent. And I think light therapy has been an absolutely fascinating example of this kind of balance that the human body exists in, this sort of narrow range of homeostasis where, you can overdo a good thing, just like you can have too much water. It's essential for health, but if you have too much, it can be actually fatal. Now, red light therapy, thankfully, if you're using a lower intensity product, what happens if you use it too often is not that there is harm. What happens, though, is that you negate the benefits. So when we do look at the studies of exposure of cells to different amounts of light, and the amount of light that your cells are exposed to is a function of two things. It's the intensity of the light, how strong that power is, and two, the duration, how much time, right? So if we're talking about a single session a day, 2 sessions a day, 3 sessions a day, we have to kind of break down these parameters. But when we look at how cells respond, we see that there's a period, it's like a normal distribution shape of a curve, right? Where in the middle, we have benefits. If there's too little, we don't have benefits. And if there's too much, we don't have benefits. We're not going to have harm as long as it's not too hot, too intense. But if we do too much, we get into that period or that place in the curve where we don't see these results that we want to be seeing. So we want to make sure that we stay in that range. Now, within that range, then, we can see that it's easy to push ourselves out of it by doing sessions that are too long, by doing sessions that are too frequent, or by using light that's too intense. And so we formulated our product with all of that in mind. And the way that we did that is the intensity of the light is essentially the same intensity as the sun. Now, that's very different than a laser. And, Anna, when you spoke to what people were seeing in clinic by using these lasers and not necessarily seeing the benefits, that's probably one of the things that was happening, is that there was just too much for that tissue. So by using that lower intensity light, we've got more wiggle room to play with in terms of how long we can be exposed to it, but still better to stay in that 10-minute once a day range. And the thing that has never failed to surprise me when I look at this research on red light therapy is how there are studies that have found that you can use it as little as 2 times a week and still see benefits. Certainly you can use it daily, but you have to make sure that you keep it at that kind of lower intensity light for that 10-minute thereabouts period. And so people really don't need to feel like I'm going to get this and I'm going to do it 3 times a day and that's going to help me more. Take the pressure off. If you do a single 10-minute session a day and you miss a few days a week, that's totally
And then
fine.
let's say once you get those desired results, what's maintenance?
Mm-hmm. Yeah, well, maintenance would be this would be essentially the same practice, right? Especially if we're talking of, well, I shouldn't necessarily say that that's a blanket statement. Let's put it into context. So if you're talking about a menopausal or a premenopausal state,
Right.
that's an ongoing, scenario of biological hormonal changes, right? So under those circumstances, I would absolutely still recommend 3 to 5 times a week of maintenance during that. If you're talking about wound healing, that's a different story, right? You're going to be dealing with the exposure, getting that wound healed. Now, the microbial effects are something that we need to think about, right? So we've got our vaginal microbiome, we've got microbes in there. If we're talking about an infectious state or a dysbiosis, let's say we have a candida infection, or maybe somebody has, obvious vaginal microbiome dysbiosis, that's a period of of treatment, there will be a period in there where you're getting yourself healed, and then there would be, a maintenance period after that. So under those circumstances, definitely you would probably be looking at a more frequent exposure during that early stage, and then you can progress into doing more of like a prophylactic maintenance 2-3 times a week. One question that has come up with a lot of people, and we don't have a really clear answer for it yet, is how blue light affects the vaginal microbiome when it's healthy. So encouragingly, there is one study that's been done that's attempted to kind of unpack that, and they didn't find that healthy microbes responded in a negative way to the blue light. But there is some research that has shown that exposure of the skin microbiome, for example, to blue light does cause it to change a little bit. So we definitely don't recommend blue light therapy every day for a healthy vagina. That's not needed. You're going to be using that blue light more when you're dealing with vaginal dysbiosis, when you're dealing with an infection. Get it back on track, and then you can use it a couple of times a week in a prophylactic.
Yeah. Well, and I think also just thinking of the shape of the wand, just thinking there's so many things you can use. I was thinking post explant surgery for my explant scars. Why didn't I think about using it? Well, it's not too late. I'm going to start using it on my explant scars. And so that scarring, tissue and to improve blood flow. So probably the red light with the near infrared light with vibration would be good. Because we don't need the blue.
Yes, absolutely. Vibration getting in with the scar
so
tissue. Yeah.
Very good. And then when you thought of the design of it, you didn't make it too wide. And what was your theory? Because there are wands that are wider diameter. And so what was your theory on that? I do like that this is thinner, less obnoxious.
Yeah, I can speak to that. So we did consult with a number of pelvic health therapists when we were designing the wand for that reason. We wanted to make sure that we felt that it was a really manageable and not an intimidating size, because a number of the women that will be using the wand are women who already have pain in that area, right? And already have maybe sensitivity essentially in that area. So that was our thought process, and we had a number of pelvic health therapists try the wand, give feedback on the wand, the exact curvature, the length of the wand, the circumference, even the amount of light, and how you already pointed it out, but the light is emitted through the entire shaft of the wand, not just in one area. So a lot of care was put into the design of the wand and making sure that it wasn't intimidating and it was very manageable. So yeah, thanks for pointing that out.
Yeah, and one more comment about that is that because the light is everywhere on the on the shaft of the wand, unlike it would be possible to just limit that to a specific area of the wand, but by having it everywhere, you don't have to put it all the way in, right? You can just insert it to your level of comfort. So for some people that might be just the tiny little bit at the end. For others it might be the entire wand. So there's a lot of flexibility.
Well, I think there's so many benefits too, because in patients that have had hysterectomy for endometriosis, there's so much fear and pain. And then there's significant atrophy if they've been denied hormonal therapy, and that's a significant issue. So being able to use it with a comfort level slowly, it makes it just adds on to our add back hormone therapy. If we're using topical DHEA or Jolva, we're using that combination that really, I see the hands of time reverse on those issues. So the combination of light, pelvic floor physical therapy is so beneficial, especially in those clients. But also the big issue that so many of my clients and women deal with is incontinence. Is that issue of incontinence and struggling with prolapse. You mentioned prolapse. So I want to define that for my audience. It is when there's a relaxation. It could be of the uterus or the upper vaginal walls, the anterior vaginal wall, the posterior vaginal wall. We call it cystocele and rectocele. There's that relaxation. We need to stimulate the muscle. We need to stimulate collagen production. We need to stimulate blood flow in those areas to regain that support structure. And sometimes people will say this is a symptom that's that's common with prolapse, is I'm fine, but by the end of the day I feel such a heaviness in my pelvic floor.
I
Yeah, and one of the things that I think is interesting when we look at the relationship between red light therapy and muscles and tissues is that we have this whole body of literature that's been expanding over the last probably 15 years on the use of light therapy for exercise. And so we can look to that for clues in terms of how these tissues are going to respond with strengthening exercises combined with exposure to light. And it's fascinating because it's been mapped out really on a cellular level how when you expose tissue to light therapy and then you have a contraction of the muscle, for example, or it's exposed and you're looking at the integrity, the structural integrity of things like the collagen and the elastin fibers, there's really a very dramatic response, and it doesn't take a lot of light to trigger that response. So for athletes, for example, you can expose a muscle to light before you go and run a sprint or do a powerlifting episode, and there's more power output. And so if you're helping somebody to deal with something like prolapse, you're combining that with pelvic floor physical therapy, getting the red light in there. You have a lot of options in terms of how you want to kind of integrate those therapies. It doesn't necessarily have to be a specific timing, but there's absolutely a documented response to
I
that kind
can
of
speak to
stimulation.
that a little further, actually, Jen, where I have a client right now with prolapse, and she
Mm-hmm.
doesn't find she needs to use the wand for the 10 minutes. So I want to highlight that because, yes, 10 minutes, 3 to 5 times a week was what I recommend. But you can play with this, right? You can even play with the intensity of light that you're providing. She midday, just as you had said, Anna, by the end of the day, she feels, this heaviness and this discomfort. So midday, essentially like after lunch, she lays down and she uses the pelvic wand, the light, the red and near infrared light setting with higher intensity vibration for 5 minutes while performing pelvic floor contraction and then relaxation, obviously, but then contraction exercises. And she feels that makes all the difference and does not feel the heaviness at the end of the day when she does do that. So I want to highlight, Jen, you had sort of said, there's no actual must do or recipe or timing. And look at this as just a case sort of scenario of this woman that's using it for 5 minutes midday and feels all the difference. So that's fantastic because she's caring for her grandchildren over the upcoming summer and she wants to be able to lift them, right? So yeah, we're seeing huge benefits with her.
That's awesome. And, again, like you have to work it into your schedule, work it into your life, but know that even if you just have that 5 minutes and make that,
Mm,
designate, carve out that time for this, then again, it's just changing the quality of life, the things you can do, like running, laughing, playing, lifting, carrying your grandchildren, doing these things without worry. And the issue when it comes to the issue of incontinence, this is so quality of life limiting. So I'd love for you to give us an example of someone that's you've
yeah,
worked with that helped.
100%. I worked with a woman last fall that I can recount. She had struggled ever since having children. I'd say her fourth child was probably about 10, 12 years old. So we're talking quite a while that this woman had struggled with incontinence. She had seen multiple pelvic health therapists. She had tried doing strengthening exercises, kind of like you name it. She felt she had tried it. I started working with her like as a pelvic health therapist, and then she did purchase the wand and she used it um, honestly very religiously. She really did stick to a program. I had to kind of pull her back from overdoing it, actually, right? Because she was so keen to make change. And it did take longer than she had anticipated. So it took a good 3 or 4 weeks before she saw results that were sort of measurable with her incontinence, right? And after that, she, having seen some positive results, continued. And I'd say 3 months later, she felt, and these are huge changes for her, but she could go to the grocery store confident that she wasn't going to, be down the whatever aisle and have a sense that she needed to go to the washroom and then, essentially have leakage. And for her, it was her trips to the grocery store, her long walks with her friends, like these things that were integral to the quality of her life. And I am happy to say she follows up with me once every month or two, depending on her schedule, just for these check-ins. And she has no incontinence. So,
Yeah.
like, huge change. And
Huge
I'm just bringing
change.
her up as an example.
Yeah, pelvic health is necessary for optimal health. And I have one of our ladies in a girlfriend doctor club. She's in her 70s and she's been using Jolva, got some benefits. And we talked about adding the red light vaginal therapy. And so she's implemented that and she's seeing continued improved results. And I think that's the statement, it's never too late. Like it's never too late. And maintenance, we know an ounce of prevention is worth a pound of cure, as the saying goes. So, prevention, when should women just prophylactically start using something like the pelvic wand?
That's a really good question. I would say for me in my practice, people are already presenting with an
With
issue,
problems,
right?
right?
So that's kind of an easy one. Most people that present into my pelvic floor practice, they already have an issue, and yes, they could probably benefit from using the wand. I have mentioned to all of essentially my pregnant but not delivered yet, say clients, that is a good time for them to start to use the wand so that they can become really acquainted with their pelvic floor and how it functions. Like, what does it feel like to be relaxed? What does it
Mhm.
feel like to contract prior to any potential, I'll say, trauma that they may have with birth? So that would be the time I would say that it would be a fantastic opportunity to use the pelvic wand and become acquainted with it and familiar with it. And then you have it essentially for life so that postpartum you can implement it when you've been cleared for internal, if you're going internal with the use, and external prior to that for any wound management.
Yeah, no, and I can see, especially in our, like say, our over 35 or over 40 women that are pregnant and going into delivery, that would be a really good practice to start before to decrease the risk of tearing and episiotomy. I'm wondering if you've done or thinking about doing any research there, but I think that's a huge thing. We want to prevent that, and being able to relax and to relax the muscles, know what that feels like, as well as tightening is a really good point.
Hmm. Yeah, that would be a wonderful research study, and then I haven't seen any research in that area, but it would literally just be a beautiful protocol to recruit pregnant women and see, longitudinally across time, could you prevent a lot of these
Yeah, and
problems from happening?
postpartum pelvic floor dysfunction, right? Again, if we can prevent it
Mhm.
through these activities, that's so powerful. So, are there any contraindications? Like, who shouldn't use this?
Yeah, good question. There are very few. And the ones that like come to mind are you wouldn't use light therapy over like an active cancer site, right? Active cancer site, that wouldn't be ideal because we don't want to really add energy, if you will, ATP to an active cancer site. And then there's always a caution if you're using not so much the wand, but say a wrap, because we also have pelvic wraps over the abdomen when someone's pregnant. There's no research that I know of that says that it's negative or contraindicated or yellow flag, nothing. However, there's always this cautionary note when someone's pregnant. So the cancer site is the only one that would be a true contraindication. Jen, can you think of any others? Did I miss any there?
No, and it's so interesting too when you look at the cancer research. For example, there's some really exciting emerging stuff on blue light and cancer cells. And then there's another body of research on red light therapy as a supportive tool during cancer therapy. And we know that it can really help, with lymphatic flow and function and all kinds of things. So I think at this point, we just really are exercising an abundance of caution. But as time goes on, hopefully there'll be more clarity as far as how these can be used. But especially if you're talking about something that has the same intensity as sunlight, really what we say to people, if they're using a red light therapy wrap or panel, and they and are thinking about using it, and they want to know how are they going to respond to that, the question is, can you be out in the sun for 10 minutes without having any kind of adverse response to it. And for most people, as long as they're not photosensitive or taking photosensitizing medication, they're fine. And certainly, if anybody is photosensitive and they want to just really err on the side of caution, you can do a couple of things very easily. One is to just start very slow. You don't do a 10-minute session. You start with 2 minutes. You see how you respond, and you increase, in increments of 2 minutes. And then our products also have the ability to reduce the intensity of the light, and that's a really nice function, especially for people who may be a little bit apprehensive about, for example, if you had a hysterectomy, you had endometriosis, you have a lot of pelvic pain, you're not sure how you're going to respond to this therapy, and you just want to be as cautious as you can be, you can reduce the intensity of the light right from the get-go, or you can reduce it during the session as well if it starts to feel a little bit warm. That is something we haven't talked about, that I'll just mention now. Near infrared light is felt as heat. So when we're talking about this light spectrum that we can't see, we can feel it on our skin or in our vaginal tissue. Now, what's been interesting talking to people is that everybody seems to feel in the vagina heat very, very differently. So when I use the wand, I feel no heat whatsoever. Liz, I know when you use the wand, you feel a little bit of a gentle warmth. So I think there's a lot of individual variability in our heat sensitivity, but just know that the use of near infrared light in red light therapy should not feel hot. If a product feels hot, there's a problem. It's either that you are extremely sensitive and you need to reduce that intensity or reduce the time, or the device is too intense and it's something that you maybe shouldn't be using because that intensity is too much. But it should be a comfortable therapy. So that's just a little commentary that I think is important for your listeners
And
to be
speaking
aware
of
of.
comfort, so being able to use a lubricant, something over the silicone device is key. I'm excited because I'm coming out with my Vaginal Intimate Moist, my Velvet product. So it has the hyaluronan and the aloe, which is designed to nurture. It's really has a good amount of aloe in there, and a water-based, chemical-free glass bottle, no microplastics. We want,
So
I'm excited
exciting.
to get that out, but what shouldn't be used on the wand when we're using it to insert for comfort, and also for we don't want to block the light frequencies. So
Yeah, that brings up two really good points. For sure, if someone's using the wand, say as a public health practitioner in their practice, then you do need to use a sleeve over top of it just for sanitary purposes, and the sleeve has to be like transparent so that the light can emit through the sleeve. So we suggest like a medical grade ultrasound sleeve, essentially, and then a water-based lubricant when you're using it, say for home use, in that the wand is a medical grade silicone, right? And so it has to have a water-based lubricant so that it doesn't interact or have any sort of breakdown of the silicone itself. So your lubricant that is coming out soon is really exciting to pair with the wand. I think it's going to be a great combination.
yeah, I'm excited
Yeah.
about that. Okay, so for everyone listening, I wanted to share with you that Fringe, I recommend this product. I like the Fringe wand. I recommend it to my clients. I recommend it to my virtual community. I'm recommending it to you because pelvic health is necessary for optimal health. You guys know me, and I'm very passionate about this. And we want to prevent disease and improve comfort and confidence in our own body. So Fringe has given us a discount code. So Dr. Anna, DRANNA, and we'll put the link below, but dranna.com/fringe. Now, you guys also have other products, like you've talked about and I'm like, God, I got to try some of these things. I only know about your wand. You've got other stuff? Tell me.
Yeah, absolutely. So we have a line of red light therapy products, many of which are really relevant, especially for women that are going through perimenopause or menopause. So we have red light therapy wraps. Liz is holding one of those up. And that's just a general tool that you can use anywhere. So my kids use it, if they've got a strain or a sprain from exercising, but you can also put it over your face if you don't want to get a face specific product, although we do have a face specific a face mask as well, which of course can support aging skin. It's interesting. There's so many parallels between the way that we deal with our face and the way that we deal with our internal pelvic region. We also have a head wrap, which is of particular interest for women that are going into that menopausal phase and experiencing brain fog and cognition. And our head wrap is unique in that it has 2 wavelengths of near infrared light. Our other products only have one. We've added an additional wavelength to that because it's deeper penetrating. And so when we want to get through the skull and the into the brain tissue, and there's remarkable research, again, this very significant body of research on cognition in terms of not only people with Alzheimer's and Parkinson's disease, but people with depression and anxiety, and even healthy individuals with no noticeable cognitive impairment have been shown to be experience cognitive improvement with red and near infrared light therapy, especially the near infrared light therapy. We also have a panel, a red light therapy panel, and that's something that people can use to help with any of these issues. You just need to have the exposure to it, but it has the additional benefit of getting light in through the eyes. And when red light specifically comes in through the eyes, travels to the brain, it helps to regulate our circadian rhythm and some of our hormones, including our reproductive hormones and our thyroid hormones. But you can, if you don't need to invest in the whole spectrum of products. You can get creative with the products that you have. I find if somebody had a pelvic wand and a wrap, that is a great combination. You can use that wrap to put it over your face, put it over your forehead to get that penetration into the head. You can put it over the neck and chest area. We also have a neck and chest specific wrap that helps with the décolletage, and we know that it also helps with thyroid function. So if you're experiencing hypoactive thyroid, one of the best things you can do is red light therapy right over that gland. It really has been shown to help. So yes, Anna, we've got a number.
One of each.
You name the body
we'll
part,
just
we've
take
got a
one of
product.
each. I wonder, in layering red light therapy with methylene blue, have you done any research on that, or?
We have not, but I mean, that's it's certainly interesting because you're getting that mitochondrial function from 2 areas. I certainly don't think that there's necessarily a contraindication there. But yeah, I'm not aware of any research that has been done to date, but definitely the 2 could be synergistic, coming at it from the mitochondria from
So
different
it's
angles.
something to talk about. I just did a podcast recently. I recorded it with Dr. Jack Cruz, who's a neurosurgeon, talks all about light.
Yeah.
So we went deep into the science. So again, using light to our benefit, and also recognize where light has been to our detriment. For example, all our EMF, blue light exposure from our smart devices. So we have to actively counteract, our environment now with bringing in more red light and the practices that increase our exposure to natural sunlight, etc. So I thank you guys for being here. Tell us what's next on the horizon for Fringe, and again, how our audience can find out more.
Yeah, absolutely. You actually just sort of led me in the direction of our next product that is hopefully going to be coming out in time for holiday is in fact a line of home lighting devices, so that we'll be able to use to get ambient red light, ambient amber light, and then a white light. So throughout the course of the day, as you light up your home, you should see variation in terms of the light exposure. And of course, none of us have been doing that for decades now. And it really has an impact on our circadian rhythm and our sleep cycles and our moods. So that's something we're excited about. And it's also being coupled with some sound frequencies that we know have some healing properties. So that's what's happening on our product line end of things. And then we are very excited about a research project proposal that we're going to be submitting to do some research on the pelvic wand, looking at benefits for menopausal women. And research, of course, is a long process and it takes a significant amount of time, but we're very committed to trying to quantify exactly how this product
and that's
women.
so helpful, right? Because that's so helpful. There's so much noise, and you really want to be able to hone in on what works. And just on that light, I'm excited for your line of lighting, because I interviewed Rudy from Viva Rays, because it's so important to wear our blue light blockers and all that good stuff. But he talked about the fire side, like the low light in the evening, and like even using those Himalayan salt lamps but at floor level for your lighting in the evening
Yes.
as that trigger that, okay, we've got to produce more melatonin. And has so, evolutionary biology is so interesting. We are designed for, we're designed as organisms, as organic creatures, part of the environment. So that a lot of this disconnect,
Exactly.
especially with light, has added to the hormonal dysfunction that we see. So it's really a big part of healing and hormonal balance. And again, of course, like never neglect the pelvic floor. Never neglect the pelvic floor. So important for quality of life. So thank you guys so much for being here. I appreciate you guys, and a lot more information they'll be able to find at Fringe. And great. And
Yes.
And if anybody wants to email me in particular, if they have questions about, light and pelvic floor therapy and so on, feel free to email me at liz@fringeheals.com. That's a good way to sort of get in touch if someone had specific questions, for sure.
Yeah, and we have a very extensive blogs and research kind of compilation on our website. So if you just go to www.fringeheals.com, go to the menu and down to the blogs and research section, there are blogs on menopause, skin care, cognition, brain health. There's lots, and I'm the one that writes them all. So they're written from a scientist perspective. Everything that we do is evidence based and science backed. So that's a big priority of ours, and we love to share education.
Oh, yeah, absolutely. That education is empowerment. And this is what I want for my audience too. You guys, this was such a rich and illuminating conversation. I hope everyone listening is walking away with a new sense of what's possible when we blend ancient healing wisdom with cutting edge science. So if the pelvic wand resonated with you, or you're curious about bringing this kind of light therapy into your own healing journey, head to dranna.com/fringe and use the code Dr. Anna, DRANNA, at checkout for a special discount. I want to thank Dr. Genevieve Newton and Liz Frey for helping us understand the science, safety, and soul behind this powerful tool. And thank you for being with me. I'm Dr. Anna Cabeca, your girlfriend doctor, reminding you to stay curious, stay empowered, and always light the way to your best health. See you next time, and God bless.
Thanks for watching another episode of the Girlfriend Doctor podcast. Check out all the links below for more.